Well, good day, and welcome to the Health and Stress edition of 5 Minute Psych. In this 5-minute segment, we'll introduce health psychology by first defining what it is and discussing why it's important to think about today. In doing so, we'll look at what behaviors we should do to drastically improve the quality and length of our life. Then we'll consider reasons that we don't change our behavior and what can be done to help us change our lives for the better. Finally, we'll look at how we might react and cope if we ever learn that we're facing a serious health crisis. Today, we recognize that psychosocial factors can impact our physical health, things like stress, our personality type, and the quality of our relationships with our friends and family. Health psychology is the branch of psychology that's focused on how these kinds of psychosocial factors impact our health. Health psychologists want us doing things that improve our health, like exercise and eating vegetables, and avoiding behaviors that impair our health, like smoking and eating donuts. Now, maybe you're scoffing at the idea that a donut could hurt you, but honestly, today's biggest killers are heart disease and cancer, both of which are strongly influenced by things that we do, like eating donuts. For instance, one longitudinal study looked at over 7,000 adults and how many of 7 good health practices they did regularly. These included sleeping 7 to 8 hours per night, eating breakfast, not smoking, not snacking, staying at a good weight, getting regular exercise, and consuming little alcohol. They looked at mortality rate of these people as a function of the number of these good health behaviors that they did. And they found that if they did less than 4 of these good health behaviors, that they were more likely to die within 5 years compared to if they did more than 3 of these good behaviors. This clearly shows that what we do is directly linked to how long we live. So no, you shouldn't scoff at the donut. But it's not like we don't know what we should do to live a long and healthy life. We know that we should exercise, eat vegetables, and avoid stress and alcohol. So why don't we? Well, first we have to recognize that there's room for us to change, or that we'll have a problem if we don't. If we don't see that smoking is bad, or we're working ourselves to the bone, then there's no point in even having a discussion about change. But if we're debating whether this is a behavior that we should work on, then the best help would be information, both about whether there's a problem and about treatments. Once we've decided to change our behavior, we need a solid plan of how to do it, and help here could entail asking experts to develop the plan. As the plan is put in motion, lots of social support would be needed to stay committed to the plan. This is the most challenging part, and it will take a lot of energy to stick to it. But it will get easier as time passes. Ideally, you want to do this change for at least 6 months, and at that point, doing the behavior should be effortless. Likely behavior change doesn't proceed smoothly the first time. There will be relapses, cheesecake in the night, or days we just don't feel like running because it's horizontal raining. It's important to recognize a relapse as just that, and not turn it into justification to completely give up. Instead, take it as a signal that the situation exceeded your coping skills at that moment. And next time, you'll be prepared for that weak point. You'll have more skills and you'll ease your way into it better. But don't give up entirely. Some of us might find ourselves faced with a serious illness one day, and there's a range in reactions for how we cope with this. The first place we vary is in seeking treatment. Some of us put up with a lot of symptoms before we go to the doctor, while others go to the doctor immediately. We also differ in how we communicate with the doctor once we're there, and many patients leave the office without understanding what they're supposed to do. Some reasons for this include shorter appointment times, but also some patients are too passive to ask because they see the doctor as an authority figure. Finally, we see a lot of variability in how well we follow the doctor's orders. In fact, some studies estimate that as many as half of us don't do exactly what the doctor said to do. We either don't do the treatment at all, or we end it early, or we change the dose, etc. We're much more likely to do what the doctor ordered if we fully understand the treatment, if it isn't aversive, and if we trust our doctor. Well, we just looked at health psychology by first defining what it is and discussing why it's important to think about today. In doing so, we looked at what behaviors we should do to improve the quality and length of our life. Then we examined reasons that we might not change our behavior and things that we can do to help us make that change in our life permanent. Finally, we looked at how we might react and cope if we, ourselves, learn that we're facing a serious health crisis. Now, aren't you glad you had 5 minutes?